Hi, I'm Dr. Christine Burke. I'm the Chief Medical Officer for the Diabetes Reversal Group. And today I want to talk to you about why diabetes is the #1 cause of blindness. So how are diabetes and blindness related? How does that even happen? Well, the process is an interesting one because in the process of developing diabetes, we develop very high blood sugars. We're all aware of that. When the blood sugar is high, it damages the inner lining of your blood vessels, and that affects the small vessels the most. So the little arteries, the little arterioles, the capillaries, and those are the size of vessels that we find in the retina, the back part of the eye, where we receive the light so that we can see. So as those vessels get damaged by the high blood sugar, that damage affects the way that the eye can receive light. Now, sometimes this happens because new blood vessels start to form. And when those new blood vessels start to form, those are a barrier to the light being able to get through into the retina. Now, some of you may already be experiencing this, and if so, you may be receiving injections actually inside the eyeball to help prevent those new blood vessels from growing because the vessels prevent us from seeing. But blindness can also develop just because the blood vessels themselves stop to nourish the retina. And when there's not enough oxygen getting to the retina of the eye, then those tissues there start to die and we start to lose our sight. That can be seen as dark spots within the eye. So all of these things develop as a consequence of the blood sugar abnormalities. But it's not just the blood sugar that damages the blood vessels, because if that were so, then taking medication that lowers your blood sugar would keep the blindness from happening. But unfortunately, that's not entirely the case. What we see is that the way the cells talk to each other, those cells, the teeny ones that line the inside of those arteries, the way that they talk to each other changes in diabetes. And we see more inflammatory chemicals, and we've all heard a lot about inflammation. And those inflammatory chemicals also create damage and cause deterioration of the blood vessels. That can make the blood vessels get leaky. And when the blood vessels are leaky, proteins can leak out of the blood and into the back of the retina, and that damages the retina as well. So we have multiple ways that diabetes is contributing to the degeneration or the damage in the retina that ultimately leads to blindness. So what's the best way to keep this from happening? Well, the best way is to reverse your diabetes completely so that we don't have the high blood sugars and we also don't have that cell-to-cell communication and that high inflammation. So if you want to reverse your diabetes and prevent blindness, then you just need to click the button below, and we have a webinar that we can share a lot more information with you.